Okay, ma'am, ready.
Both are ready?
Yes, I'm ready.
Okay. So if you've read and understood, considering it communication skills station, please begin.
Hi, I'm Dr. Fyong. I'm one of the surgical doctors. I'm calling to speak with the on-call consultant to inform him about a post-mastectomy patient and to seek his advice. Please, can I confirm I'm speaking with the on-call consultant?
Yes, I am the on-call consultant.
Okay, the patient is an elderly patient. She had a mastectomy 2 days ago, an axillary clearance, and she's a known COPD with mild left ventricular failure. But she, however, developed shortness of breath and axillary swelling. And I spent like 20 minutes trying to convince the daughter, and the daughter is insisting that she wants to take her home. So I was calling to seek for your advice.
Okay. Has the patient made their own decision or has been bullied into making a decision to go home today?
Okay, I think the daughter was the one that convinced her to take her home because the patient herself wanted to go to her own apartment when she was stable.
Mm-hmm. Is the patient alert and can make her own decision?
Oh, I'm not so very sure of that, but after this call, I'll have to examine her and be sure she has the capacity to make an informed decision.
Okay. What do you think has happened to this patient?
Okay, with the blood we are seeing in the drain, we are thinking that very likely the patient has a reactionary hemorrhage from the surgery site, and also keeping in mind that she developed shortness of breath, it's also likely that she has had an axillary vein thrombosis and a pulmonary embolism.
Okay. What could be the cause of bleeding in this case?
Okay, it can be from slipped ligature or slipped clip, and it could have been as a result of direct injury to the blood vessels during the surgery.
You mentioned that the patient have shortness of breath. What could be the causes for this, doctor?
Okay, yeah, she's a known COPD, so it could be because of chronic obstructive pulmonary disease, and also it can be as a result of heart failure and even the pulmonary embolism we are suspecting.
Okay. What are the causes of axillary swelling?
Sorry, I didn't get that.
Causes of axillary swelling.
Okay, it can be as a result of lymphedema and also as a result of post-op hematoma at the site of the surgery and axillary vein thrombosis.
Okay, what will be the plan of action in the event of this complication?
Okay, for the bleeding at the axillary swelling that is suspected to be a bleeding, I would like to do some blood investigations like the full blood count to look out for the hemoglobin, the level of the hemoglobin. I also like to do a clotting profile to rule out any bleeding problems. Then definitively I would like to consider evacuation of the hematoma. Then, in view of the shortness of breath, I would like to do CTPA since we are suspecting CT pulmonary angiogram since we are suspecting a pulmonary embolism, an arterial blood gas, and also a chest X-ray. And definitively, if it's seen that she has a pulmonary embolism, I'll resuscitate using the ABCD approach and comment low molecular weight heparin and inform the ITU registrar.
Okay, is she stable now?
She's stable now, but we have in mind that she might have a pulmonary embolism, and that was why I was trying to talk to the daughter that she should be safer being in a facility.
What will you do if they were insisting to go home?
Okay, first of all, I'll again counsel and explain to the daughter and to the patient the complications. and also the fact that they are staying about the distance where their home is far from the hospital. And after explaining the complications to them, if they are still insisting on going, I will let them know that I can't discharge them medically, and they'll need to sign a legal document showing that they have understood the complications and they are willing to bear the responsibilities for any complications that may arise. And I'll also counsel her on things to look out for that could mean the example is if the shortness of breath is worsening, or if the blood loss from the surgery side is increasing, then you should find a way to the nearest hospital.
Okay. What will you do for the drain if it is 410 ml? Are
Okay,
you going to remove it?
No, I won't remove it. I'll let the drain, but I'll, however, teach her how to take care of the drain. And then I'll also tell her and counsel her to know if the drain is draining less than, or the volume of drain is reducing like less than 200 mils per day, that she can go to her GP or a nearby clinic and have it removed.
Okay, doctor. You can do that now.
Okay, thank you.
Okay, thank you.
Thank you.
You still had 1.5 minutes. Okay,
All right.
thanks. Right.